Okay. Hello everyone. My name is Roland Woodward. I'm making this video in regards to my orthodontic or maxillofacial or double jaw surgery that I have coming up at the end of the year. Um, I've already had one surgery of two that I have to get, and I wish I could put a video up a little bit sooner so you could see me before that first surgery and hear me speak before I got this appliance put in my mouth. We'll get to all that in a minute. But I'm basically just making this video to track my progress, and possibly I can help somebody else out the way that people on YouTube help me out by putting their videos up. It really helped me out a lot. Gave me a lot of good information. Let me know that I'm not the only one out here with this problem. You know, like I thought I was. Um, so I definitely appreciate it, and I hope I can help somebody else out the way that you all helped me. Um, okay. Well, like I said, I already got one surgery of the two that I have to get. The first surgery was just to widen my top jaw, because my top jaw was too narrow, they said. My top teeth used to sit on the inside of my bottom teeth, and it should be on the outside, the other way around. So they put this appliance in my mouth. If you can see it. Put this appliance in my mouth, and when I went in for surgery, they widened my top jaw a little bit, and then closed it back. I had to crank the appliance 3 times a day, and each crank widened my top jaw 0.25 millimeters. So I cranked that all the way up until I got to 8 millimeters, which is why you see this 8 millimeter gap that I have in between my teeth right now. The gap wasn't always there. My teeth used to all be together, but the surgery, because of me widening my jaw, it caused a gap right there. My top jaw was so narrow that when I got my wisdom teeth pulled out a couple years ago, they also pulled out my top two back molars because they were causing crowding in my top teeth. I'm sure you can see it. You know, I got teeth growing all the way out there. Crowded. All because of my wisdom teeth and my back two molars. And, you know, my top jaw didn't have room for those teeth. So now after the surgery, when my teeth shift back, since my jaw's been widened, I will have room. I don't know what's going to happen with that. I'm thinking I'm going to have to get 2 more implants later on. Haven't really discussed that with my surgeons at all. I'll be updating you on that when I get an update myself. Um, let's see. So now that that part of the surgery is pretty much done, now I just have to wear this appliance for a couple more months until I'm completely healed, and then they're going to take this out. 2 days from now, I'm going in to get my braces put in on both the top and bottom teeth. My braces are basically just going to align my teeth, get rid of all the crowding up top, close the gap, and just make sure my teeth are straight. The braces also is going to make my underbite just a little bit worse. I should be pushing my top teeth back a little bit and my bottom teeth forward, and that will be that'll make my teeth where they should be. And I guess they say that I move my teeth around, just basically trying to compensate for my underbite, trying to keep my mouth closed. I trying to close my bottom, basically keep my mouth closed. My bottom lip push my bottom teeth back. So when I get the braces, it's going to put them forward to where they should be. Right now, I have about 15 millimeters worth of space in between my top and bottom teeth. As you can see, it's pretty massive. And let me show you the side view. Hope you can see it. Yeah. A lot of people say that since I had this first surgery, my Sarpy surgery, my underbite is not nearly as bad as it was. Which I don't really see that, but that's what I mean. I guess other people see me more than I see myself, so they know. I guess I don't know, but yeah, I guess my underbite used to look a little bit worse. Um, Believe it or not. But once I get my braces in a couple days, I'm going to be. Let's see. I get my braces in a couple days, and towards the end of the year, everything should be aligned to where it needs to be, and I'll go in for my double jaw surgery, or my maxillofacial or orthodontic, whatever you want to call it. And basically, what's going to happen is they're going to cut two pieces out of my bottom jaw towards the back, discard of those pieces, push my jaw back, put screws and plates in it to hold it in place, and they're going to detach my top jaw from my skull, cut it into three different pieces, move each piece forward, put screws and plates in that to hold it in place. And because I have to do such a huge movement, um, they might have to take a little piece of bone from my hip or somewhere to close the gap up. Um, they say this surgery that I'm getting is a last resort, and they say there's no doubt in anybody's mind that this is the surgery that I have to get. Um, a lot of people might think that this is just a cosmetic surgery, but I'm here to assure you that it is not. They say if I did not get this surgery, I would probably have all type of digestive problems because I can't really eat that well. You know, that's kind of hard just to bite a sandwich or eat an apple or anything like that. And I only bite down on two teeth on my left side. So those teeth will be all decayed, and then I won't have pretty much anything to chew with after that. Um, what else? I said it would cause TMJ, basically a lot of pain in my joints in my jaw after a while because of the way my teeth are aligned. Sometimes you can hear a little clicking and popping in it, not much like a lot of other people say, but it's there a little. I said that's a good sign of TMJ, forming in your jaw. So um, yeah, it's more medical than anything. I mean, honestly, yeah, I always thought that I looked kind of funny and talk funny. I always got jokes cracked on me, etc., etc. So it was something that I pretty much wanted to do all my life. And now me knowing that it's medical more than anything, it's like, okay, yeah, let's do it. If it was all cosmetic, and honestly, recently now that I'm older, I was thinking like, I don't really want to do it just for cosmetics, because I gotta live with that the rest of my life. That I got this surgery done just so I can look better for something superficial, which I didn't really want to do. I didn't want to feel like I just got a nose job or something like that. I don't like the way I look, you know. So the fact that it's medical really, really helped me out a lot. Made me make the decision that okay, I'm going to go through with it. Um, yeah. So basically, that's all that's going to be happening. I'm going to be putting more videos up, tracking my progress. You can see what I look like after my braces and after my surgery, week by week, or however. I'm not too sure exactly how I'm going to do it. We'll see how I feel. Um, I don't know. People just upload your comments. Any questions or concerns you may have, hit me up, and I'll try to help you out the best I can. Alright, thanks for watching my video. Y'all take it easy.